Good morning or good afternoon, officially.
Yep. Hi, welcome.
Hi.
Hello, hello.
Hi, everyone.
Happy to see some faces today. Sometimes people are welcome to keep their cameras off for today's presentation, but it's always lovely to see some smiling faces back. So, and some cats.
Oh,
Oh my
that's
goodness, what beautiful eyes.
yeah. Cats do they do seem to like computers, don't they? So welcome everyone. Really appreciate you being here today. And this is a topic that being anxious and is a topic that we haven't actually had a presentation on before. When I can't remember where else you were presenting, Dr. Harvey, but I saw the advertisement and I thought this is something that our community, I'm sure, could benefit from as well. So we really appreciate you being here and look forward to some of your messages. So thank you.
Yeah, thank you guys for having me. Should I dive right in from here?
Sure, go right ahead.
Excellent. So hello, everyone, and welcome to my talk today on how to support anxious children in being brave. So we can dive right in, and I'm going to start with a brief introduction of myself so you have a little bit of background on me. So I am a child, adolescent, and family psychologist at Manhattan Psychology Group, which is located on the Upper West Side. I am licensed in the states of New York, New Jersey, and Idaho. I specialize in providing evidence-based treatment for oppositional defiant disorder, ADHD, selective mutism, as well as other childhood anxiety disorders. And my favorite type of work truly is working with you, working with parents, and really helping to empower you to both manage difficult behavior while also having a warm relationship with your children and helping them to build distress tolerance. So really excited to be invited here for this parent talk today. So we're going to start with kind of a mini crash course on anxiety. So you have a little bit of background on it before we talk about how to treat it. Okay, so what is anxiety? Anxiety is one of the countless emotions that we experience in our day-to-day lives. And the American Psychiatric Association defines anxiety as the anticipation of future threat. And I often refer to anxiety as our body's internal alarm system, which alerts us to potential dangers in our world. Anxiety in and of itself is not a bad thing. It truly functions to help keep us safe from any threats and truly ensure our survival as a human race. However, it can become problematic when we experience excessive false alarms, where our anxiety gets triggered time and time again, despite us not being in true danger. And there are three ways that we commonly refer to how anxiety can present itself. So first, we can have anxious thoughts. We can experience physical sensations in our bodies when we feel anxious or any other emotions. And we can engage in a range of behaviors when we are experiencing anxiety. So you can see there's arrows connecting these three pieces here. Our thoughts, feelings, and behaviors are all connected, and they have a drastic impact on one another to either further heighten our anxiety or help us to self-regulate and think more rationally. So I'm going to explore these in a little bit more detail. Okay, so when it comes to physical sensations associated with anxiety, no two people are alike. We all have very unique experiences in terms of how our body reacts to anxiety. Some of the most common physical symptoms of anxiety are listed here in terms of muscle tension, increased heart rate, breathing more quickly, experiencing nausea or stomach aches, which we often see with the younger kiddos, having butterflies or knots in your belly, trembling, shaking, sweating. Some others that aren't listed here include dizziness, headaches, pain or tightness in your chest, blushing, tingling, feeling faint. The list goes on and on. So you could probably look at this list and identify the ways which you can relate to this. Maybe you can think of times that you've observed this in your child, or your child has reported having a stomach ache to you and they did not seem ill. So there's a variety of ways that we can experience this here. In terms of our thoughts, there are a few themes that tend to come up with anxiety. First are worried thoughts, where we anticipate an unwanted stressor to occur. So an example of this might be they're all going to laugh at me, or I'm going to fall and get hurt. Sometimes our anxiety takes it to the next level where we expect the worst case scenario to occur. So a little one experiencing separation anxiety, for example, might worry that the parent will get hurt if they're not together, or their parent could die if they are not together. So really more of these more extreme worries. And our anxious thoughts can also involve setting unrealistic expectations for ourselves. So an example of this might be, I must get to school on time, otherwise my teacher will think badly about me. I have to get every answer right on an exam. I know you guys are dealing with little ones, so they're not worried about tests yet, but just so you have an example of this anxiety around getting everything right and everything being perfect. So there's a few different ways that these thoughts can come up. And finally, behaviors. Again, a few themes tend to emerge here when it comes to anxiety. By and large, anxious children and adults tend to stay away or avoid situations that trigger anxiety for them. So some children might be a chatterbox when they're around familiar family or friends, but once they're in the presence of strangers, they go silent. Someone who is fearful of small spaces or elevators, they might take the stairs whenever possible so that they're not even dealing with that anxiety. Or if we have someone who's frightened by big dogs, they might cross the street whenever they see one coming their way. So really avoiding any opportunity to be around this feared stressor. Another anxious behavior is over-preparing for a future stressor. So for young children, this can look like asking their parents excessive questions or repeated questions about an upcoming vacation. So when are we leaving? What do I need to pack? What are we going to do when we're there? They can ask all of these questions or the same questions over and over and over again to over-prepare. And finally, someone might actually engage in a very specific ritual to seemingly prevent a feared stressor from occurring. So for example, some kids might engage in a very rigid morning routine where they have to do everything in a specific order and in a specific manner. And they might be doing this to ensure that they don't get in a car accident on the way to school, or that nobody gets hurt on the way to school. So sometimes the reasoning behind these behaviors don't always connect, but the anxiety is driving them to do these things to, again, avoid something that they don't want to happen. Here we go. Okay, so it's important to know that these attempts to avoid feared situations, it's a solution to the problem. If a child is fearful of being away from their parent, they're going to do whatever they can do to avoid that uncomfortable feeling of being away from them. For some children, this might be clinging to their parent, crying, screaming, or even engaging in a tantrum to further delay that separation from happening. And these avoidant behaviors, they function to reduce their anxiety in the short term. So in this separation anxiety example, clinging to their parent gives them access to them a little bit longer and momentarily prevents them from being separated from them, or might delay the parent from dropping them off at school or at a play date. So these behaviors, they're effective in avoiding the feared situation over time. And it's only going to reinforce that anxiety and strengthen that fear if they continue to repeat these behaviors time and time again to avoid that stressor. So I'm going to go through this again with a very specific example. So many of the children that I work with experience anxiety when they have to speak in front of the class. So maybe it's a morning meeting, or they're going over the weather or the day of the week. So imagine this scenario. The teacher asks them a question in front of the class. So maybe it's, what day is today? So this triggers anxiety for the child. Maybe they're worried about saying the wrong thing. And this thought might cause their heart to start racing and their hands to start shaking. And because of this spike in physical anxiety, they freeze and avoid answering. Generally, when we see children in distress, adults also experience a spike in anxiety. So what does our own anxiety cause us to do? Usually we jump in and rescue that child from those really uncomfortable feelings. So the teacher in this scenario might remove the expectation that the child needs to answer them and tell them, don't worry about it, and go on to another child in the class. This will actually result in a short-term reduction in both the student's anxiety and the teacher's anxiety, because the trigger to both of their levels of discomfort has been removed and they got through that awkward and uncomfortable moment. But what results is that student is likely going to repeat that behavior in the future. And they're going to continue to rely on their teacher or another caregiver to rescue them when they're uncomfortable, when they're in distress, which is only going to maintain their anxiety. So we call this whole thing negative reinforcement. So negative meaning we are removing the unwanted stressor. So in this situation, we removed the expectation that the child needed to talk in front of the class. And reinforcement refers to the likelihood that this behavior, this cycle, will repeat itself, since the removal of the stress helps everyone to feel better in the short term. However, this is just one instance. Imagine how many times this child may have successfully avoided speaking in front of the entire class. The more that they successfully avoid it, the more intense their fear will grow in the long run. So in a nutshell, this vicious cycle demonstrates that well-intentioned adults can inadvertently strengthen children's anxiety rather than letting them sit with that discomfort. Okay. And one thing we didn't mention at the beginning is that I am going to be taking questions at the end. So feel free to put them in the chat. Susan is going to be keeping track of them, and we will circle back at them at the end. Okay, so let's transition into discussing how caregivers can play a role in their child's anxiety. Okay. If you are a parent or caregiver of a child with a history of anxiety, you've probably experienced times in which you felt torn about how to handle fearful situations. You may have thought to yourself, this is terrifying for them. Should I rescue them from their fears? Or their peers can do it. Should I just push them to face their fears? If either of these thoughts resonate with you, you are not alone. And for those of you who fall in line with my thought bubble on the left here, my next slide is for you. So research has found that all mammals' brains are hardwired to protect and rescue their youth. We are not born with basic skills and tools required for survival. In fact, young mammals and babies are terrible at ensuring their own safety, ensuring that their needs are being met, and at self-soothing. So naturally, they rely on their parents to do these things for them. And mammal parents are extremely attuned to their child's fear cues. So when in fear, children are incredibly skilled at drawing their parents in. You could see that here, especially in this bottom picture here. And naturally, the parent will immediately respond to these cues and help their child to feel calm again. So this is all hardwired into our brain. So supporting children through anxious situations, it's not intuitive. A lot of what I'm going to be teaching you today is going to go against what your gut instincts might do when your child is in distress. And honestly, I work with families day in and day out where the parents fundamentally disagree in this area. One caregiver may feel the need to relieve their child's distress and help them avoid feared situations. And we refer to this as protective parenting. While the other parent may feel that their child just needs to be more independent and get over it to overcome this fear. And this is often referred to as demanding parenting. And the good news is that both of these seemingly opposite perspectives are correct. So, in fact, the key to promoting bravery and helping to build distress tolerance in young children, older children, teenagers, even in adults, is to combine both of these perspectives. And Dr. Eli Leibowitz, who is a professor and clinical psychologist at Yale University, he calls this combined approach supportive parenting. So one way parents can articulate this kind of support to their child is by using what Dr. Leibowitz calls a supportive statement. Supportive statements have two main ingredients. We want to accept and validate the child's fearful experience and simultaneously exude confidence that the child can withstand slightly more discomfort than they have up until this point. So some examples of this are, it frightened you, but I know you'll be okay. My job is to help build your brave muscles. And it may be hard, and I know we can practice it together. So here are just some examples. There's not one single supportive statement you can use. There's so many different ways that we can use this tool. And we're going to be going over a few examples together and practice it together. So for this portion, we can have some audience participation here, whether you are typing it in the chat or if you wanted to unmute yourself to let me know what supportive statement you're thinking of putting together. But I'm going to provide 3 quotes one at a time. And for each one, I want you to let me know whether the quote would fall under protective or demanding parenting, and then potentially rephrase it into a supportive statement. So like I said before, there's no one right answer for these supportive statements. As long as you combine the 2 ingredients of validation and confidence, you're correct. So first quote, she can't handle it. So any guesses? I'm going to open up the chat if you guys wanted to put it in the chat, or you can unmute yourself. So first I want to know, is this protective or demanding?
Protective.
I'm seeing a couple protective in the chat. I heard a protective, so you are correct. The first one is protective parenting. Now, anyone brave enough to take a stab at a supportive statement here?
I'll take a stab.
Okay, thanks, Jody.
Maybe something like, it seems to feel uncomfortable. Yeah, I believe in you. You know, let's take a try.
Love that. So you combine the two ingredients, acknowledging that it's uncomfortable. And again, your confidence, I believe in you. So here's just another one that I came up with. But like I said, there's no one correct answer. Similar to what Jody said, it may be tough, but she can get through it. So instead of kind of labeling this child as someone who can't handle it, we are acknowledging the difficulty and our belief that they can get through it. Okay, next one. Come on, this isn't that scary. Protective or demanding parenting. Yep, I'm seeing a few come in the chat already. Demanding, demanding, demanding. Excellent job, guys. So you're correct. This is demanding parenting. Any, again, other brave volunteers to come up with a supportive statement? Either.
Something like, I
Uh-huh.
see you're scared, but we can do it together or something like that.
Excellent. Thanks, Jennifer, for volunteering. Yes, love that supportive statement. Acknowledging I see you're scared and we can do it together. Another one I came up with, I know that you can do scary things with some practice. So just essentially saying the same thing you said in slightly different words. And I see Mrs. Pope said this is scary, but we are okay. Perfect. So you're helping to build that distress tolerance that we can sit with this discomfort to overcome the situation. Okay, last one on this slide. You need my protection. Yep, this one's kind of built in there. Protective, correct, guys, in the chat. And what are our thoughts for a supportive statement?
Can it be in reverse order? Can you say something like, I know you can, I feel you can do this. I'm here if you need me.
Yeah, I think that works because you're offering that help and support and that confidence. So that works. It's similar to what I said here. I'm here to help you build your brave muscles. So excellent. Love that you guys are playing around with the format of this so that you have a variety of ways to phrase it in your back pocket after today. Okay, thank you, everyone. Thank you to our brave volunteers. Okay. So building bravery through exposures. So how can you as parents and caregivers really help to build bravery through exposures? There we go. Okay, so I'm going to bring us back to the negative reinforcement cycle of anxiety that I reviewed earlier. So the key to building bravery is interrupt this vicious cycle here. So when parents and caregivers take the supportive stance we've been discussing and simultaneously refrain from rescuing children from feared situations, children will learn to get comfortable being uncomfortable and build distress tolerance. So what is this thing called exposures? Exposures are when we practice approaching situations that trigger fear, anxiety, or any level of discomfort for us. We aren't just doing this one time, but many times practicing approaching the uncomfortable situation, because with repeated practice, children will increase their distress tolerance, build bravery in the face of their fears, boost their self-confidence and self-esteem, and better cope with these uncomfortable feelings of anxiety. However, it is important to keep in mind that these positive changes They don't happen overnight. They require time, patience, and lots of practice. The key to exposures is to take small steps that gradually increase in difficulty. So starting with practicing areas of low anxiety and getting more and more comfortable in this area with repeated practice before targeting areas of moderate anxiety and ultimately areas of high anxiety. Keep in mind that every child who suffers from anxiety is unique. Some may call for more support or smaller steps or additional repeated practice than others. So consulting with a licensed clinician who specializes in treating anxiety will help to find the best plan for your child's specific set of needs. So I thought I would transition into some more specific examples of low, medium, and high level exposures, as well as individualized supportive statements for 3 different versions of anxiety. But I do want to caution again that even if your child struggles with one of the situations that I'm listing in the next few slides, even if they struggle with it, the exposure that I have listed here may not be appropriate for your child. Again, no 2 kids are alike, and every child needs to proceed at their own pace to best set them up for success. So let's go through our first example here, which covers reassurance seeking. And as a reminder, reassurance seeking is when children ask frequent questions or repeatedly check in with their parents regarding their worries. And for some children, they might ask the same question over and over and over again, even if you just answered it. Okay, I went a little too fast there. Okay, so for some children, they might be anxious about making a mistake and they might ask, did I do something wrong several times over? Other kids might ask an excessive number of questions about a specific topic. So again, if they're anxious about the babysitter coming over, they might be asking, which babysitter is coming? What time are they coming? What time will you be back? Are you going to put me to bed? What if I need you? Can I call you? Just tons and tons of questions. So one potential exposure parents and caregivers might do is put a limit on how many questions they will answer in the morning, in the afternoon, and in the evening. Some children might tolerate starting with 3 in the morning with a low level exposure and then proceed to 1 answer in the mid-level exposure, and ultimately refraining from providing any answers so that we are helping them practice not getting the information that they want in anxious situations so they can deal and build that distress tolerance for not getting that information. Another option when it comes to reassurance seeking is putting a limit on how many times a parent will answer a repeated question. So maybe we're starting with 3 maximum answers to 1 question, and then ultimately decreasing that number to 0 over time. And I've done this a lot with kind of like the younger age kids. They tend to ask a lot more questions. So a potential supportive statement for this situation might be, it might feel scary to go to sleep without us, and I know you can handle it. So that might be related to questions around bedtime. So limiting your answers and giving them that supportive statement. Okay. I'll move on to my next example. So this is going to cover going mute when in the presence of strangers. So this might be waitstaff at a restaurant, the cashier at a grocery store, an Uber driver. And at the risk of sounding like a broken record, each child's starting point for exposures here is going to greatly vary. So imagine the stranger asking, what's that stuffed animal you got on your lap? One parent might start by repeating the question and supporting the child in answering the parent in front of the stranger. So something like, tell me, what's that stuffed animal you got on your lap? Once the child is able to consistently answer the parent in front of the stranger, then the parent might kick it up a notch and support their child in providing a one-word answer to the stranger. So maybe the parent says, great telling me, now tell the driver lion. So it's just a one-word answer. And a good long-term goal or a high-level exposure could be supporting the child and answering the stranger with a full sentence. So maybe the kiddo is expected to say, its name is Simba. Okay, and one potential supportive statement here is talking to strangers can be hard, but I'm 100% confident you could speak to me in front of the ice cream man. So a longer supportive statement here, but it's more customized to this specific situation with brave talking. And finally, some kiddos have very rigid and lengthy bedtime routines. They might prefer that certain scripts are said between the parent and child at certain times. They might prefer that certain tasks like brushing their teeth or putting their pajamas on or reading a book, that they're done in a very specific order or manner. So parents might start by targeting flexibility and changing the order in which certain tasks are done. They might increase the difficulty by reducing the amount of time they spend laying down with the child before they're asleep. And finally, parents might work their way up to giving quick goodnight hugs and kisses and immediately leaving the room, allowing the child to fall asleep independently. Any other brave volunteers to try and put together a supportive statement for this situation, trying to customize it to bedtime routines? And this is hard stuff because sometimes I even need to think, how do I word this? So it's learning a new language to talk to your child about. I'm just going to open the chat to see if anyone plugged that in. Okay. I can give this one to you guys. I know that this is a hard ask. Okay, so the one I came up with, there we go, is it can be difficult to change our routine, but I'm sure you can practice being brave and flexible. So like I said before, there's no one right answer here. As long as we are exuding that confidence, validating the child's experience, and in this situation, you can make it customized and tailored to the specific exposure. Okay, I think that's all I wanted to do on this slide. Great. So if you wanted to find out more about supportive parenting, I highly recommend that you purchased Eli Leibowitz's book, Breaking Free of Child Anxiety and OCD. It's an easy read, free of jargon, and we'll go through countless more examples of anxious behaviors and how well-intentioned caregivers can inadvertently strengthen their child's anxiety. Okay, so I wanted to end today with a little bit of guidance on when it is a good time to seek out support for your child's anxiety. Okay, so a parent's internal battle of when to wait and when to take steps to address their child's anxiety or excessive shyness, it's a real one. It's a daunting and confusing decision because you may be getting mixed messages from loved ones, from schools, from outside providers of what is considered, quote, normal. So these are actual real quotes from families that I've worked with. Almost every family I've worked with has battled with the decision of when is that right time. And with specifically with selective mutism, I think that's one where oftentimes parents might be told from like pediatricians or other loved ones, just give them time, they'll come out of their shell. That's something that I hear a lot, and it only kind of snowballs from there. So this is a real challenge for a lot of families. Okay, so the answer to this question, did I skip anything? I did, that's why, sorry. Okay, so there we go. So with a child who's genetically predisposed to anxiety, often we can see this early in life. So there might be a really intense wariness around strangers. They might be really difficult to soothe or hesitant to join group activities. So I'm thinking of these kids who are really frozen when they walk into like their preschool classroom, or have more of that deer in the headlights presentation. So if you imagine all the kids playing Simon Says, they're the ones standing there that like very slowly are touching their head or barely even moving their bodies. However, having a more introverted temperament doesn't necessarily mean that your child will develop an anxiety disorder. So how can you as a parent know whether your child needs help overcoming their anxiety or whether they're just a little bit more introverted or shy on that personality spectrum? So the answer is when your child's inhibition or avoidance behaviors or their anxiety is negatively affecting their functioning at home, at school, or community settings. So some questions to help you determine whether this might be happening for your child. Has their anxiety or shyness prevented them from establishing or maintaining meaningful friendships, regularly attending school, communicating with peers or teachers at school, participating in birthday parties, extracurricular activities, or other group gatherings, engaging in activities that they actually enjoy, interacting with familiar adults in their community, neighbors, extended families, doctors, or being able to calmly separate from immediate family members. Do they almost always appear or feel anxious in these situations? And if so, has this been a consistent pattern for a month or longer? We're not just talking about one instance. We really want to see that this is happening repeatedly over time. And does your child's shyness or their need for your support and reassurance, does it cause you distress? Maybe they don't look like they're in distress, but you're feeling overwhelmed with these anxious behaviors. If you find yourself answering yes to a lot of these questions, it's possible that your child could benefit from increased support to help them build that distress tolerance in their specific feared situations. So talk to your child's primary care physician, a school counselor, or a mental health professional regarding referrals for your child's specific challenges. You could also give us a call at Manhattan Psychology Group. We're here to help and would love to set up a phone call just to hear what your concerns are and see if the services we offer would be a good fit for you and for your family. Here's a little bit of information on Manhattan Psychology Group. I'm not going to go through all of it in a lot of detail here, but we provide virtual and in-person services in the Upper West Side of Manhattan. We also have a satellite office in Long Island City, but we serve all of New York State, all of New York City. We provide a range of evidence-based services. And we have psychologists, neuropsychologists, board-certified behavior analysts, and special educators on our team. So we can provide psychological testing, ABA services, or a range of evidence-based treatment. Our vision is to help create a future where individuals and their families feel supported, connected, and empowered, and to provide multidisciplinary integrated support for individuals and their families with mental health, behavioral, or educational challenges. So I got through that a little bit faster than I expected, I guess because of your great, brave volunteers who were able to dive in with those supportive statements. So I'm going to stop my PowerPoint here. There we go. And change you guys to gallery view so I can see everyone.